Hi, this is Dr. Doug at Diamond Dental Care and Implant Centre. With all the changes that have happened in dentistry over the last week, and with dentistry Australia-wide moving to level 3 restrictions, I want to talk you through and walk you through some of the changes that have happened at our practice in case you are one of the unfortunate people who has to attend with a dental emergency in the near future. So starting at the very beginning, if you have a problem, a dental problem that's an emergency and need our help, then please call us first of all on 5477 0889. That number again is 5477 0889. We will then get back to you as soon as we can, and we will triage if it's one of the problems that we're allowed to treat. If so, we can make an arrangement to see you at the dental practice. Otherwise, we can give you some advice or perhaps prescribe pain relief or antibiotics. Moving on, once you've arrived for an appointment, we're going to ask you to wait in the car park in your car, and we'll call you on the number that you give us when we're ready to take you in for the appointment. This is so that we just have as few people in the building at any one time as possible. As soon as you go through the door, you're going to see that we have signs up. If you have a high temperature, coughing, sore throat, shortness of breath, any of these things, then we're not going to be able to see you for the appointment. We'll go upstairs now and have a look at what it's like as you enter the building. Okay, so we've teleported upstairs. Just another point that I've thought of is when you come along for your appointment, we would ideally, if you're an adult, just have yourself attending the appointment. Again, we want as few people in the building, possibly transferring germs. The door may be locked at the top of the stairs. Again, the reason for this would be so that we can control who is coming in and out of the building. If that's the case, then we'll have a chair at the top of the stairwell where you can sit, or again, please go down and sit in your car and we'll contact you on the phone number you've given us. So as soon as we come through the door, we're going to ask you to hand sanitize for 20 seconds with the alcohol hand rub. All our staff do this as they enter the building. We've all re-accredited recently with Hand Hygiene Australia. I want you to note as well the barrier that we don't want you to cross close to reception. Also, we do have chairs in the waiting room. They're more than 2 meters apart, but we're actually we would prefer that people stay in their cars down in the car park, and we'll call them up rather than waiting in the waiting room. Moving over, the other thing we'll do as you enter is we'll take your temperature with a touchless thermometer. This is just placed close to your forehead, and we're looking for temperatures below 38 degrees. Anyone who does have a raised temperature, we're going to ask them to go and see their doctor, find out what's wrong with them. Most commonly it will be a common cold or something like that, but we can't see you if you've got a temperature above 38 degrees. The thermometer gets cleaned down with isopropyl alcohol in between every usage. So here we are in one of our dental surgeries now. It is out of hours and it's not set up exactly as it would and should be when I've got one of my helpful team members here. As you enter, we're going to get you to wash your hands with soap and water for 40 to 60 seconds. When you sit down, we're going to give you a particular mouthwash to swill around your mouth for between 30 seconds, and in some cases, for some people, it might be longer. You'll then spit that back into the cup afterwards. That's to reduce the load of bacteria and viruses in your mouth before we do anything. When you come into the room will have had a double clean down before you come in. So before any patients come in up till now, we always clean the room down according to Australian standard protocol. We've added to that a second clean down using a 0.1% solution of hypochlorite on all the hard surfaces and handles and buttons and all those things. So another thing that we're doing between patients is steam mopping the floors. It's worth noting as well, this is obvious to us in dentistry, but to patients, just to reassure you, all the instruments we use have been through a sterilizer autoclave cycle that gets it to a certain temperature and pressure for a certain length of time and renders these things sterile to use in your mouth. All these are bar-coded, and then we scan that into your notes, and then those are tracked within your notes, and we can refer back to that batch and prove that it has completed its cycles properly. So now that we're finished in the surgery, we're going to go out to the reception desk, and I'll just talk you through the last part of your appointment with us. So here we are at the checkout desk. When you sit down here, we are going to ask you to hand sanitize once again with the alcohol rub. Our high caps machine, our telephone, our keyboards are all barrier wrapped, and the barrier wrap is for the high caps machine is changed between patients. We'll give you a pen to sign things with. That'll be a Diamond Dental Care pen, yours to keep. No one else will have used it. As you can see, we're taking a lot of extra measures and a lot of extra time between patients in order to be able to see you for your toothaches safely and reduce any risk of spreading this nasty disease. So thanks for watching. That completes our tour of the practice to show you some of the changes that COVID-19 has brought into the practice. And I hope that this gives you confidence that if you have a dental emergency, then we are a safe place to visit. Thank you.